was a quite recent piece of research that my colleague in Cheshire and Mersey, who does the same job as me over there in the ICB, and I undertook with the support and collaboration with the University of Chester. So we had lots of anecdotal information about what learners and educators, so when I say educators, I mean university lecturers predominantly, thought about adult social care as a learning setting, so as a clinical learning environment. And also we really wanted to hear more about how that then linked through into their perceptions of adult social care as a career choice. So we wanted to have some more robust kind of data, if you like, as a baseline. And we worked with universities and some students, etc., to get a good cohort together for this research. So I'm just going to go through what it was and some of the findings, which I think you might find quite interesting. So hopefully. So obviously there's quite a bit of background. I won't read through the whole thing because you'll have the slides afterwards. But basically, and this has just been reiterated with the kind of recent publication last week of various different operating models and frameworks and so on from Department of Health and Social Care and NHS England. So adult social care plays and will be playing an increasingly vital role in our health and care services, but just in terms of our health services, because obviously the university students are on health and care related courses. So we wanted to focus on that really. Hospitals are overwhelmed. Discharges can be challenging. Obviously, we all need to work together to try and address that, particularly at the moment when it's a real challenge. The context obviously is care closer to home or at home wherever possible, and registered health professionals who work within adult social care organisations like yours across the Northwest are developing skills and proficiencies that will really benefit our pre-registrant learners on nursing and AHP, allied health professional courses. And yet still currently placements within adult social care can be treated as non-clinical. So I'll elaborate on that in a minute. So there's a bit of government shift there, but obviously that's now even more updated with the 3 key shifts and in the setting of the Better Care Fund priorities and etc. that have just come out. But it's still all very relevant. So the study was to present initial findings around the perspectives of learners and educators around adult social care, around the extent to which those undertaking social care, learning placements or teaching of it envisage social care as an important part of their education and or part of their future careers. We did an online survey initially as the data collection point. The sample was nursing or healthcare related undergraduate students and their tutors and lecturers, and we had 53 participants, of which 8 were educators, and an even spread of participants across 3 years of undergraduate study. The majority were actually pre-reg nurses, so that was 37 of them, but others were studying other courses and some had undertaken placements in social care settings. That's a little bit about the data collection. So to jump straight into the key findings, and then I'll kind of elaborate a little bit more with some of the data from the survey. So the key findings, the key 5 that we sort of pulled out were: many students reported positive experiences in social care placements, but a small minority of learners expressed frustration at social care learning practices. And it's important to note that there were some of those negative experiences. The quality and quantity of related teaching provision is more important than just the bare presence of social care as a topic. So it's about quality and quantity, not just having social care on the curriculum or a placement, of some kind. Students evidenced a good level of holistic focus, showing an understanding of the needs of service users, and so obviously some of them refer to them as patients, even though that's not what we would refer to them as, with many referring to the importance of supporting service user, people who draw on care and supports independence. So they really did have a strong perception of that. Many participants stated that social care education was really important to them, to understanding how care links together across the health and care system. So some really reassuring things there, but also some, need for action. So looking at some more detail of the data and just briefly talking through this, only a quarter of the students surveyed had experienced social care through their educational studies. So 75% of our students are not encountering social care as part of their course. Yet across all questions, students showed a robust knowledge of the value of social care towards holistic models of healthcare. So the vast majority had experienced social care through either personal experience or educational studies. Quite a few actually, had previously worked in social care or were still working in social care alongside their course, so they had a lot of insight. And some, obviously about 27%, had experienced a placement in social care already. So that's just a kind of a snapshot really as to where their experience had come from. So some of the perspectives some of the kind of comments that came out, I would like to work in social care once qualifying, as I feel it's more holistic and you have more time to make therapeutic relationships with service users compared to other settings. Someone put, I believe social care is an essential part in the prevention of people getting unwell. And to have a wider knowledge, you must look at any situation with a background of information. This allows you to understand a person on a more human level. However, there were also some comments which were, more on the negative side. So one learner had quite a bad experience and had said that you get no preparation. They throw you in without care. And I think that was with reference to their university. They didn't feel adequately prepared for their placements. And the other myth, which obviously is not true, but social care is where nurses at the end of their career often go. So we had some of those stereotypes and some negative things that obviously we need to work on. So then we asked, would you pursue a career in social care? So it was actually quite encouraging, I thought, relative to, kind of the coverage of social care on courses and placements at the moment. 33% of those surveyed said yes, 29% said no, and another 38% maybe. So they, definitely could be nudged in the direction of a yes. Educator said, this is such an important discussion to be having, and it's great it's happening now, but it should have been having it at least 10 years ago. The key message is for social care sector to be valued in terms of the people served and supported, in terms of staff remuneration, and as a valid and exciting career destination. And we did have 4 more kind of comments that we haven't included because obviously we've got limited space and time, but it was very much along the same kind of message that many students have a desire to help others and are very motivated to pursue a career in social care because they find that it's a more holistic setting where you can have those therapeutic relationships on an ongoing basis. So that was that. So we did a bit of a word cloud, and we asked the question. Oh, sorry, just jump forward. we asked the question, you know, what comes to mind when you think of social care? And care obviously comes out top, no surprise there. Package of care, safeguarding, holistic care. So a whole variety of different things, but obviously people are well aware that it's about care in the same context as their kind of focus of their degree as well. So in relation to broader studies, we asked how useful do you think social care placements are in acquiring the knowledge, skills and proficiencies required for your registration? And the blue is unsure or not useful, but the vast majority of responses were in the brown phase, and that's very useful and useful. So I can't see off the top of my head just from the graph I've got in front of me, but it's probably around 80% said it was very useful or useful. So regardless of whether they'd had experience themselves, regardless of whether they thought they'd go and work in social care, they absolutely valued it as a place where they could acquire essential knowledge, skills and proficiencies, which is a really good opportunity for us to provide that. And the next question was, how important is it to you that social care is included as part of your studies or teaching? And again, the vast majority of the respondents, both learners and educators, said it was very important or important. So they really do want it, and they're not currently getting it. Only about 25% of them were having any input around social care as part of their learning experience at the moment. So in terms of their view of whether it was a clinical placement, and obviously there's many different aspects to learning, and not all of it is, you know, the kind of absolute clinical bits, but we wanted to bust the myth that it can't be a clinical placement. So anyway, we asked for primary care, did you think it was clinical, non-clinical, not sure, or other? And the vast majority, 63%, thought that primary care was a clinical placement. Compare that to social care, and it's about 33% thought it was clinical. And we had some really kind of confused responses in terms of it can't be clinical if people aren't wearing a uniform, for example. Now, we know a lot of staff in social care do wear uniforms, but in some settings they don't. But that doesn't necessarily mean just because you're not wearing uniform that it's not clinical. So we had a few, you know, kind of confused learners who were a little bit kind of confused, and that's one of the things that we need to obviously overcome. So in terms of proficiencies that they thought could be met, these were just a few of the comments there. So it requires everything the course covers and more. You need to gain confidence and experience to do the job correctly and independently. It teaches kindness, empathy, problem solving, advocacy, research-based care, and excellent clinical skills. And that was from an educator. I won't read them all out because you can read them at your leisure later. But again, some really positive experiences of what can be achieved from a very clinical and a holistic perspective. So the conclusions that we drew, kind of next steps as well from this, is that basically preparation for practice in social care settings from the university's perspective is inadequate at the moment. Students are not adequately prepared for social care and future integration requirements. More taught content pertaining to social care is needed on university courses, and we suggest that there's a significant call to action for higher education institutions, universities, is required. So that is the end of that presentation. So I'll just shut that one down. I would love to take questions now, but we'll just hold that thought until we come to the end. Because the reason why I wanted to put these two things together is because that gives a bit of the landscape as to where we are now. We've already developed in Greater Manchester a resource which we stop sharing that, which we can use as a starting point to try and address some of that. And I wanted to just show you that and etc. There's lots of information for all the different stakeholders. But also at the end, I want to kind of ask you and let you know about another piece of work that we're about to embark on, which will again go some way to addressing some of those issues that came up in that research that we've done. So without further ado, I'll just get my other PowerPoint open, which is quite relatively brief, but will give opportunity for lots of discussion, and I'll demonstrate the website where we've got this information. And I'm mindful we've got quite a few more people have joined us, which is fantastic. Okay, so just share that. Okay, Gemma, can you see that okay?
Yeah, we can see that, yeah.
Lovely, okie dokie. Right, so you may have seen this knocking around for quite some time. It has been live and was launched in January last year, but it's still obviously really, really relevant and hasn't reached everybody that it needs to reach. And it also helps us to have a resource to start to address some of those issues that came up in that research and that we all already suspected were the case. So I just wanted to kind of show you this, and I will kind of go through the guide, but I'll just kind of take through one step at a time. So we have a group in Greater Manchester called the Greater Manchester Social Care Learning Environments Group, and it's got a cross-section of all different stakeholders from across Greater Manchester. It's an amazing group. We've been meeting now for about 2.5 years each month. And this is a piece of work that we decided to undertake, about 18 months ago, and took quite a long time to bring to fruition, as you'll see when you see the micro website. It's, there's a lot involved in it. And for those providers that are on this call and others, if you would be interested in joining a group that's focusing on social care learning environments, and it's not just the clinical, it's not just the pre-reg, we look at the whole spectrum, then obviously please do get in touch with me, and I'll put my details at the end, because we have a number of providers on that group, but with pressures, etc., it's not always easy for people to come. So we want to widen the membership from providers, particularly because obviously it's all about you, really. It's all about your workforce and what can support you. So just sort of jump in with that ask straight away. So this guide was developed. It's a guide to adult social care clinical learning environments, as opposed to, this is focused on that pre-reg learning cohort. We're not really looking at specifically at apprenticeships, but obviously a lot of the learning with apprenticeships, is clinical. But this was very much focused on that pre-reg cohort who come out on placements as part of their course. And again, with T levels, it could be applicable to T levels, but wasn't written with that in mind. So just thought I'd raise that up front. So it was developed to increase awareness and understanding of the adult social care workforce who are already working in partnership with healthcare colleagues to provide person-centred care and support for our Greater Manchester residents. And we wanted to inspire and support learner placements and clinical learning environments in adult social care settings for pre-reg nurses, trainee nurse associates or student nurse associates, as they're being called now, and allied health professionals as well. And you're probably aware we've got some fantastic models and fantastic experience in Greater Manchester, where we've had learners from different specialisms working together as part of, for example, the integrated names escaping me. So IPE, it'll come back to me in a minute. So we've got some great things already going on. We just want to open that up to everybody, obviously. So the target audiences and the reasons why, really. So we're targeting at this learners, so all the students who might be thinking about a career in adult social care or healthcare. It doesn't matter, because they still really need to learn about social care and the skills as part of their training. Adult social care employers, considering how learners might benefit you, your organisation and staff, and those who draw on your services. Higher education institutions who want to know more about the range of opportunities for high quality learning that your learners can benefit from in adult social care settings. And professionals from any sector wanting a better understanding of adult social care and supporting learners in their role. So that's who we're aiming at. So I will click through now and hope that it pops up on the right screen to the website where this is hosted, and I'll just show you a few sections of it. So that's the website address. So I'm just going to click on that and hope that that's can you see the website now?
Yeah, it's taken us to the website.
Yeah, okie dokie. So this is the home page, and you can click start here. But what I'd like to do is just show you the different sections. So we've got an introduction with a bit of forward, and the introductions to, I've said why we developed the guide and why do we need the guide. So if we click on that, we've got some of our learners and some of our registered managers have obviously written a little bit about why they thought this was needed. So, for example, this one here, it will help to break down barriers, dispel myths, and ultimately go towards helping people to be looked after in their own homes. Caroline from St George's, it's a great opportunity to showcase the great opportunities that are on offer within social care to a whole range of learners. And Rowena wrote, it's important because it helps to show the relationship between the NHS and social care, which needs to be better understood if we're working towards a truly integrated and innovative offer, etc., etc. So we've got those, and then you can click through to the longer case study, because each of these people have submitted a case study either about their career, their experience of placements, etc. And all of those are also in here. So if I click through to career stories, if you want to be able to highlight people who've gone through the social care profession, we've got Jez on the call, and Jez did a case study about his career, as did Rowena Gale and Melissa Stanton from the Royal College of Nursing, who came through a registered manager route to where she is now as a social care lead. So we've got that. Okay, so go back to the next section then. We really wanted to start from basics, so I apologise that some of this is probably far too basic for some of the people on this call, but because there is a general kind of not great understanding of what social care is out there amongst other, groups of people, we just really wanted to kind of set the scene about what adult social care is, kind of the overarching kind of context, etc. And obviously there's some links there to further information. We've got the different service settings, again with some links, and who provides adult social care in Greater Manchester. We've got who uses social care, again with a couple of links. We thought it was really important to give examples of the sort of jobs that you can do in social care. So we've got the regulated professions, we've got management roles, direct care roles, ancillary roles, other social care support roles. So just a really simple diagram there. And then something that I've used actually with groups already, and learners and educators, etc., is addressing some of the myths and truths about social care. So we've got the Skills for Care video embedded in there. But if we go to the next page, we asked people to share with us some of their myths and truths, and we've got quite a few, obviously, there. So you can click through. So social care is a second-class experience and not equal to other NHS-led experiences to learn or work. So that's false. And then we've got obviously a quote from Rowena's case study, if you like, which backs up that the fact that it's false. So for everyone, whether it's true or false, we've got some evidence from our GM contributors, which kind of explains why that's the case. So feel free, you know, obviously they're quite useful to do like a bit of a pop quiz as part of presentations and etc. etc. So then we've got kind of, again, the basics of what is a clinical learning environment in social care. And I don't know, people on this call, I don't know which of you take learners already, which of you might be interested in taking learners. Everybody will have a different kind of, you know, kind of where they're at the moment. But we've got some of the, you know, kind of, it must be this, a bit of explaining about the tariff that can be and the guidance around placements, and what we aspire that clinical learning environments should be, and referencing our actually GM health and care learning environment strategy, which is just being refreshed. So that's there for some more information. And then how to become a social care clinical learning environment, a very simple kind of infographic there really about what to do. And at the moment, we're lucky enough to have a social care practice education team at Greater Manchester Training Hub, who some of you may already be in contact with. But some of you may have placements or could have placements directly from universities and have more contact with them. But this service is really valuable and supports people from, I'm vaguely interested in having placements, or I want to know a bit more about it, through to supporting during them and any issues that come up, etc. So that's that. So I won't go through all the different advantages, but I think we thought it was really important to show that there's advantages to all different groups of having the clinical learners in social care. So we've got advantages overall, like improved emotional health and social connectedness, improved physical health. Those were two outcomes that came out of having learners in social care. But there's advantages for people who draw on care and support, advantages for the learners themselves, which is obviously some of the things that will add to, you know, and sort of contribute towards addressing some of those issues that came out in the research I showed you earlier. Advantages for social care settings. So what's in it for you, basically, as an employer, about upskilling and growing your own future workforce, raising the profile as a career, aids with recruitment and retention, etc. Lots of advantages there. And we've got some case studies at the end there. So if anybody wants to have a look at some of the learners that have been on placement and their experience, they're very, very inspiring. So please feel free there. So we wanted to then move on to, you know, you could have a career in social care. So introductory page there, and we've done an infographic around career progression. So some of the same job roles that we had in the previous slide, but we've kind of gone a bit beyond that really as well, into kind of where could you end up at in the future. You know, we've got some fantastic people in all different areas, so operational, managerial. You could go in the future into a strategy role, you know, a policy role, into research. You could become a clinical or senior, you know, specialist clinical role, or quality and assurance. And I'm sure there's ones that I haven't put on here, you know, omitted by mistake, but just gives a bit of a broader view of, you know, we get the 350 career thing that in the NHS, but we haven't really got the equivalent in the same way for social care. We want it to be a very aspirational career opportunity for people. And that is a quick whistle-stop tour really through that. So I'm just going to hop back to the presentation. I've just got a couple more slides to share with you. Hopefully that's back up. It started from the beginning, so I'll just click forward. So I've done the demonstration. So we have got a call to action. So anyone on this call today, so learners, we want them to ask your course staff about doing a placement in social care and tell others about social care placements. We do have a small group of social care student ambassadors who are current students. And we want to grow that going forward. So it's kind of a word of mouth, peer to peer at university, so that they're spreading the word about their experience and the opportunities that are there. For employers, if you haven't had placements before, ask about that. If you have, share your experiences far and wide. We're happy to support with that. We can put it on the guide website, because the more we shout about it, the better. Universities, we are aspiring that every learner that goes through a health and care course at university will at least have had access to this guide as a starting point of information. We think it will probably be really useful to include on the curriculum and as part of the preparation for placement and careers information and advice. So we've got a resource, we want people to be using it. So we're moving into that phase even further now. Professionals, ask your employer about how you can get involved with supporting learners or contact us to become a social care career ambassador. We're always looking for professionals, social care professionals who could potentially go and do a micro teach in a university, share their experiences, etc., etc. Go to a careers event at a university to highlight what opportunities there are. Health and social care organisations, we want people to share it with their networks and promote it as far and wide as possible, because not many places have got such an interactive kind of accessible resource as we have in Greater Manchester. So we just want people to be able to know that it's there. And obviously we have said people outside GM can use it, and they are as well, even though some of it is GM specific. We have got some comms materials, we've got some social media assets, we've got leaflets about the guide which could be printed out. Obviously you can share the link, etc. So that'll be in the slide deck when you get it. I won't go through those in any detail just now. And that's the last slide with my contact details, which I will put into the chat as well. And then we can go into the Q&A. So I'll end the slideshow there. Stop sharing. Stop speaking. Take a drink. Yeah, over to questions.
I'll just stop the recording as well, just so that none of the questions and things are in there.